Miss Varga, my patient is on his way back to his room from the post-anesthesia care unit.
The PACU.
The nurse and I just got a report about his status. Are you able to come with me to assess him?
Tell me about him.
8 weeks ago, he had a colostomy after a bowel perforation related to diverticulitis. He just had surgery to close the colostomy and perform a re-anastomosis of the colon.
At this point, what do you focus on?
Accurate assessments and associated interventions, right?
Yes, ongoing assessments are crucial after surgery. Early identification of post-operative complications is very important. So, you've received a report from the PACU nurse. Did you review all of the OR and PACU data?
Yes, the floor nurse and I looked at it together.
Okay, let's go assess your patient.
Mr. Lombard? Mr. Lombard? Hi, I'm Rose. I'm a student nurse. You're back in your room after surgery. I'm going to be helping to take care of you today. This is Miss Varga, my nursing instructor. How are you doing?
All right.
Well, we want to see how you're doing after your surgery. We need to take a look at you and check you out, okay? Can I double check your ID band, please? Thank you. And your full name is?
Lombard Richard F.
Okay. And your birthday?
11 November 1963.
Okay, thank you, Mr. Lombard. Now, as I said, we need to check how you're doing. Listen to your breathing, that sort of thing. Let's put your head up a little.
Good. You want him in a safe position. Semi-Fowler's is fine. Note his level of consciousness.
Right. Well, he's sleepy, but easily awakened. Now, I'll get his vital signs.
Okay, good.
Okay, Mr. Lombard, I'm going to take your temperature, pulse, respiratory rate, and blood pressure now. Okay. All right. Open your mouth, please. And I'm putting the thermometer under your tongue. Great.
You'll want to assess the patient's respiratory status, including checking that his airway is patent and assessing breath sounds. You already measured his respiratory rate.
Okay. Okay, Mr. Lombard, I'm just going to unsnap your gown. Okay. Breath sounds are a little diminished, but clear. Now, I'm going to clean my stethoscope. Okay. All right. I'm just going to put a little clip on your finger.
What? Huh?
Oh, it's okay, Mr. Lombard. You were just napping. I'm checking your oxygen saturation level with this machine on your finger. It's 96 to 97 with the oxygen at 2 liters per minute.
Okay. Now, how about the patient's cardiovascular status?
Well, I measured his blood pressure and pulse, which were stable.
Okay, and note his skin coloring.
Pinkish, a little dark around the eyes.
What about the skin temperature of his lower extremities?
Okay. Okay, a little bit cool to the touch, especially the feet.
All right, well, sometimes you could use an extra blanket or a heated one to provide warmth. You see, the operating room is cold, so you'll want to make sure the patient is warm to provide comfort and also to prevent complications.
Okay. All right, here you go, Mr. Lombard.
Good. This information related to his respiratory and cardiovascular status will be helpful as we continue to monitor him. Any changes can signal possible complications. Now what are you going to do?
I'm going to check the dressing on his surgical site. I'm going to look for color, odor, presence of drains, and amount of drainage. Okay, Mr. Lombard, I'm just going to pull this down and look at your surgery site. Okay, looks okay. No bleeding or drainage on the dressing, and he doesn't have a drain.
Okay, we also need to turn him to make sure that there isn't blood pooling under him, even though we don't see any on the dressing.
Right, okay. Mr. Lombard, we're going to turn you a little. Okay, can you hold on to this blanket?
Hold on with both hands.
Okay,
Good.
we're going to turn towards Miss Varga, just a little.
Okay, just
Oh,
a little bit.
good, good. No bleeding,
Okay.
no bleeding, good. Okay, you can come back. And I'm going to take this blanket for you.
Huh?
Oh, it's okay, Mr. Lombard. Everything looks good. How do you feel?
Dopey.
Oh, well, that's pretty normal. Now I'll check his Foley catheter and note his urinary output.
Whatever. As long as you don't have to put that colostomy back in.
Not doing that, Mr. Lombard. No worries. Okay. 150 milliliters of clear urine since an hour ago. Looks good.
Very good. Now, why don't we check his IV site and see how that looks?
Okay, let's take a look at your IV, Mr. Lombard. No infiltration or redness. I should check the solution and the rate, right?
Yes, very good. Validate that they are correct.
Okay, it's correct, as ordered.
Okay. So, how would you assess for pain?
I'd ask. He says he's okay, but he's still kind of out of it. No grimacing or crying. Are you sure you're feeling all right, Mr. Lombard? Any pain?
Not really. I'd say no pain.
That's good to hear.
So, you'll want to keep the bed in the lowest position with the side rails up and keep the patient safe. Of course, perform hand hygiene and document your assessment findings.
All done, Mr. Lombard. You can rest now. I'll be back soon to check on you.
Good. At this point, you need to check Mr. Lombard's vital signs every 30 minutes for the next 2 hours. Remember to always check facility policy regarding frequency of postoperative assessments.
Okay, Mr. Lombard, the call bell. It's right here, okay? You got it? There you go. You need anything, you ring, right?
Okay, maybe later.
Thank you, Mr. Lombard.